पूछो जाके उनसे जिन पे रोशनी नहीं, पूछो जाके उनसे कैसी लगती है कमी.
Because an investment in knowledge pays the best interest. I would like to notify you all that we'll be having a discussion session towards the end. So in case if you have any doubts, drop them in the chat box. It will be discussed at the end. And most importantly, if the session ends, make sure to rejoin with the same link. So moving forward with today's session, we have a special guest from all the way from USA, Dr. Richard, who will be talking regarding vision and fall assessment and prevention. A brief introduction about him. He's an OD, PhD, and MPA. He holds doctorate in biomedicine and optometry. He's a diplomate in public health and environmental vision of American Academy of Optometry. So, hello, sir. It's a pleasure to have you here. You may proceed now.
Thank you. The subject of falls and prevention and assessment is something that you might not think that optometrists are available or something that optometrists might be interested. What I am trying to encourage optometrists is to think outside of just the glasses and contacts or just looking at the eyeball. In order to ensure that optometry continues to be relevant in the future, optometry needs to engage itself with the daily life of its patients, more than just seeing, but also things like health. And one of the most common problems is falls. And that's why I consider falls as being a critical component of being preventative more than just dealing with glasses, eyes, and contact lenses. So today I'm going to be talking about falls and prevention, both as assessment and prevention. These are my opinions, not of my colleagues, and I don't have any, this is not a solicitation of any sort. And this particular objective of this course is to give you a little bit about the epidemiology of falls. That means how often it comes, what are the risks, and those sorts of things. We're going to give you a little bit of assessment of one of the major factors in falls, that's balance. Because if you can assess balance, you can probably detect or determine or predict falls. I'm also going to try to give you some common things that we can talk about and how we can prevent falls at home, because that's where falls mainly happen. About 3/4 of all falls happen in the home. Just as a side light, I'm just going to give you, entertainment, which is a picture. In your daily, you might be looking at the eye, and you could look at this later on. You can compare that one eye is different from the other. That's one of the clues about falls. Usually, one half of the body is slightly different than the other. So, in general, the biology is that in a normal person, they should be similar, just like the eyes. There should be no difference between the right and left half of the bodies. So, the interesting thing about falls is that it's pretty similar in India and the United States. And we would think a little bit that just because there's cultural differences, density populations, in actuality, they're actually pretty similar. There's a slight difference. In India, it's probably close to about 1/3. And in the United States, very similar also. And the top 4 risk factors, according to Rubenstein, are weakness. That means muscle weakness. It could be also limb weakness or ability to hold an arm up. Balance, that means is that if they stand up, they fall, or they feel a little bit like dizzy. Thirdly, you can actually have a deficiency in the way you walk. In other words, you could drag a feet. You could also, have different type of steps, different from walking. You can also cross your legs. Those are when you walk. Those are what we call gait deficiencies. And lastly, vision. So in the ability to understand other than vision is important in falls, because vision is a component, but it's the 4th. It's not necessarily the highest one, but it is important for optometrists to consider all of the top leading causes and risks for falls. The importance of falls is that it will lead to a head injury. So what we want to be sure is that if we can, detect or elicit a history of falls, we can say, you know what, you should be careful, or we know that there's some chance that you will get another fall within the year. And usually the second fall is sometimes more serious than the first. And of course, when we talk about falls, we're talking about limiting your mobility because of the fact that if you fear a fall or you're injured in the first fall, you're going to be limited in the way you walk or get out of the house. And in general, people really like the fact that they can get out and do whatever they want. But if they're limited in because of an injury or a fear, that's going to really would also create a potential for fall. Now, as one gets age, there is probably, it's wise to think about using grab bars and railings in some very important places. Typically, it's the bathroom. If the bathroom happens to have a grab bar or some type of railing, because there's a lot of movement. You got to turn around. You might be inside the shower or bathtub. You have to get in or some things like that. Also, poor lighting. And again, that's probably visual related. If you have most homes are not brightly lit like it's in the sun, but one of the things that is that if the hallways or the walkways do happen to have better lighting than normal, you probably have reduced the chances of falls. Let's talk about vision and how it relates to falls. We know that vision impairment, which is defined of, some people define the word vision impairment as saying a number. It's worse than 20/40, worse than 2200. And some other people talk about vision impairment based on the inability to do something. So we call it, whether it's when we talk about vision impairment, there are two ways. One is called numbers definition. The other one's called function. And many times, as I actually am more, I am more attracted to function than it says 20/40, 20/20, because when you give a number like a 20/40 or 2200, you really don't know how that person functions. So a person with 20/40 who happens to have a gait problem may actually have a greater risk problem than a person who's 2200 and is perfectly has good balance. So in general, Snellen acuity, which is what I was talking about, is a poor indicator for falls. Now, there are people who talk about some better ways to judge spatial relationships. One is the Howard-Dolman test. Now, if you haven't heard about that test was originally used in pilot training. If you've ever seen a movie or something, you look down a box and you try to line up two vertical sticks with drawstrings, and you tell them, can you line them up so they're parallel? That's a good indicator of what their spatial relationships. Now, you can also check spatial relationships in your own office. You can say, you can put two chairs in front of somebody. You can say, which chair is nearer to you, which is further, and that's a kind of like a rough and ready test. Or you can put, two coins together, very close together. One halfway on top, which is which coin is the one that's below, which is on top. And that's one way. It's kind of like a really rough test, the same thing. Or you can say you have two coins and tell them to match the coins so that they're in the same horizontal distance. That's what that particular test is. Also, what happens if vision is much worse in one eye, that's another risk for a fall. And usually that occurs sometimes in people with cataracts, where the cataract occurs more often than more severe in one eye and the other. Then there's going to be disparity. This also comes when people have had cataract surgery in one eye, but not in both, or they may have a bandage in one eye or other types of things. The last thing that is a possibility is contrast sensitivity. Now, we call that smoky vision. Just imagine, if you can think of as if you walked into a room and there's a lot of cigarette smoke, you kind of look at people and they're kind of hazy. That's what contrast sensitivity. Or when you drive at night or walk in the night and it's kind of foggy, things are kind of hazy. Also, when the sunset, occurs and kind of the glare occurs, that affects contrast sensitivity. So just to review again, Snellen is not a good indicator of falls. Judging relationships is better, even monocular vision, the presence of monocular vision differences, and also contrast sensitivity may be better indicators of the risk for falls than Snellen acuity. So here's a particular test. What happens if we, a study that says, what happens if we try to change the vision to prevent falls? And we can see that in general, it's not necessarily, it may help in the very beginning, and they still may help, but you can see that the chances of fall aren't necessarily related. So there is lots of literature, and that's why a lot of people in medicine will say, well, you know what, vision isn't necessarily related. But in this particular test, you know, they asked the person, you know, self-report over a period of time, was the glasses give you fear or give you a chance of a fall? So a lot of times when you hear studies like this, it's kind of nice to look at the actual study, but because people don't, they will take conclusions and say, you know what, glasses and falls makes no difference. So, but I believe there, you know, the limitations of the study are sufficient that I still think that glasses and vision are affected and can affect falls. So again, on the aspect of glasses, here's a particular test. Lord 2002 said that if you wear bifocal glasses, you're twice as likely to fall. This is a reference I did. But you know what, when you look at the study, what they did was they gave the glasses to the person and told them to come back 1 year later. Well, what does that mean? Did they adjust the glasses? If they had difficulty, were they able? So, you know, in other words, I know that glasses and multifocals could increase the chances of fall, and it may alarm us to feel that it is so. But in general, when most people give glasses, they make sure it's fit. So one way to make sure that you don't increase the risk of falls is make sure you give a pair of glasses that are well fitted and well designed so that the patient can walk around when they have. So a lot of times in your office, after you dispense the glasses, when I was in practice, I had them walk around, and I happened to have a situation where I can had a kind of like a miniature box they can walk up and walk down, and I saw how they were how they perform. And I also advised them how to tilt their head when they were using multifocals so they can see their way when they're walking up and down types of stairs. So although glasses have been found to cause problems, I think if we put intervention in of advice of how you dispense the glasses, how you train the person to use the glasses, I think the chances are fall. So although the study is widely quoted and may be used against glasses, bifocal glasses, it is based on the fact that the study was restricted to the fact that they just gave the glasses and told them to come back. So, and one test below here called Haran said that they tested, well, let's take a look. This is actually a little bit more realistic. Here's a test study that says, compared the use of single vision glasses versus multifocal glasses, and they found that in a randomized control study that there is a likelihood or association that if you wear single vision glasses rather than multifocals, your walking ability is better. But is this clinically significant since the reduction in fall was only 8%? So that's not necessarily a lot. So it may be more, but it's, again, in the scheme of things, in my opinion, overall, the study may be statistically significant differences, but is it clinically significant to say that you should definitely prefer single vision glasses for walking? Now, personally, if I was selling glasses, I would say, yeah, I think you ought to wear single vision glasses and get multifocal glasses, because one without the other, they both work together. So in general, that's a good reason to have two pairs of glasses. And you say, hey, when you're walking around, wear the single vision glasses because you have a less chance of falling. So that would be a stimulus to prescribe two pairs of glasses or to dispense two pairs of glasses. This is just a kind of like a little you know, a rest thought. And again, when we look at two eyes, and when you're studying, and if you get a chance to look at eyes, make sure you always look at two eyes, not just one. Because if you forget the other eye or don't get a chance, you really can't say there's something wrong. So always compare the two eyes. You'll be surprised what you see on the other eye. So how do we determine a fall? So we've talked about assessment. So we have two simple tests that you could do. One is to ask the person about the fall, and the other one is to give a slight test to do, we'll call the get up and go test. Actually, there's a third assessment, and that's called the Romberg test, which gives a little bit about balance and a little bit about your, you know, whether you have any other type of issues related to aversions and things of that sort. So again, falls can be determined by two simple tests. They could be done in your office. I've done it in an office where there was one room, where there's multiple rooms. Again, we can do this. Now here's the tests. If you had a person, this is a kind of like a history question. You say, have you ever had a fall at all in the last 12 months? And what happens is that you should ask them. Now, sometimes people don't remember that they had a fall. Well, if they fall and hit their head, then that would be pretty serious, because that means that they didn't even remember it. In general, most people will remember a fall, and if they can't remember the fall, that may be a normal aging memory loss. But again, this idea of the fall, that most people will remember because they get scared when they fall. They generally remember it. They may not remember every factor of it, but what's important to assess what the facts of the fall is. And just a simple test would be grip their hand, one hand or versus the other. If the grip is different from the other, then there's a chance that there's a imbalance in the reflexes. You can also ask for one of the other reasons for a fall is the fact that they take too many medications. Sometimes too many medications can cause dizziness and sorts of things like that. And too many medications, we generally think that 8 to 10 medications at one time is too many medications, but for some people, even 3. So it depends on the type of medication. And then, of course, there's the situation where you stand up and you seem like your head, the blood flows from the brain. That's called hypotension, and you get a little bit dizzy there. But that's not necessarily as common. You can have a fall, but you can, if you listen to the history, that's part of the risk profile. Now, let's suppose that you had someone who had more than one fall. Then, actually, it's more important to get the history. And what you might discover in the person with more than one fall is that there actually is a lot more serious issues that we should be attending to. There's probably a medical problem of some sort, and also that they're getting worse. So when we talk about issues of risk for falls, and why second one is that there's some change that's occurring over a period of 1 year. And one way also to check is, again, there is a connection between cognition, or the ability to understand things and remembering, and falls. So we should be able to try to differentiate whether a person's forgetful for things that are like just yesterday versus something that 2-3 years ago. You might not be able to determine with any significance between the two, but the fact that you could elicit that comment, you say, hey, you could say the patient remembered what happened yesterday, the local news, or what happened a year ago, where did you live when you grew up. That's a great way to quickly assess memory that's from long ago and memory that's recent. So that's actually pretty important, because if there's a difference between the two, then you could have the beginning of what we call cognitive impairment, or even early dementia. Now, there are other things that you can detect, is that, we call it cerebellar functions, and that's has a lot to do with things like sleeping, breathing, and the ability to, have the weakness or strength equal in both hands, because cerebellar functions actually dictates walking. And a lot of times, if you have a deficit in cerebellar function, that could be the beginning of a cerebellar function deficit. And of course, there are other things that could be related to history. If you have any cardiovascular problems, how's your heart rate, what's your blood pressure? Because in general, cardiovascular issues can cause, edema, or, edema in the legs, inability to walk a flight of stairs because it's too tiring. That's not necessarily tiring, it's actually the heart really working overtime. So now, the other aspect that you can, when you have more than 2 falls, is when the first fall occurs, there's incredibly, like up to 1/3 of the people actually fear a second fall. And actually, the second fall actually makes you more prone to actually more falls, because you're so fearful that you are going to fall that you actually fall. So, and also, when people have their first fall, and people tell them what to do in their home to make sure that they can remain safe, they don't follow through. So again, the fear of falling actually creates more falls, and actually prevents actually prevents people from making a change. So sometimes intervention by a family member is necessary to ensure that they're following. That means that their medications are good, they follow a regular doctor, and they make sure their house is as risk-free as possible from falls. Now, the fear of falling can also lead to what we call anxiety and depression. Because it's common in older adults, it's actually the fear, again, I had mentioned previously, can cause greater and greater depression, as Bashar said in 2006. And also, if you, again, I also said the fact that if you happen to fear falling, you can actually create a greater chance of falling. So in Friedman, this was found that actually there was much more common the rate of falls afterwards was actually higher. Here, one of the tests for balance is what we call the Romberg test. This is just a short clip. Very short clip. You stand in front of behind a person, raise arm, and you just see if they steady, and have somebody stand behind them so they don't fall. So the person who has an imbalance will fall backwards, and if the person more than they fall forward. So that is a test. Make sure that you can actually have them close their eye. In this particular study, demonstration, the person's wearing dark glasses instead of closing their eyes, but closing their eyes is probably more. So that's how you do the test. The other way you can do a test that, yes? Okay, so I want to give you intervention that you could do is there's an ancient Chinese test called Tai Chi. Tai Chi has been shown to improve and lessen the fear of falling. So if there's any type of movement exercise, Tai Chi is something that's important. So again, this is just a little bit, kind of a summary for me, is the fact that falls and eyes are related more than we think. It's related to all of this aspect of the people. And if we concentrate on this model, then we actually will continue to be relevant. If we just talk only about vision impairment on the left, which is correcting glasses, we will miss all the other abilities that we can engage with. And so therefore, we're not just being sought for advice on improving vision. We will be able to give advice on how people do their daily lives. And we can also talk about how people integrate with others and prevent withdrawal symptoms. So in general, check for falls for the last year, check depth perception and spatial vision, history, Polypharmacy. The get up and go test I didn't get a chance to talk to. You have the person sit in a chair and with the arms, and then have them get up and walk 10 feet and come back. And then that's called the get up and go. That's a very simple test. You can do it in any office, and how fast you do it is important. And if you wanted to improve reduce the risk of falling, suggest balancing exercises such as Tai Chi. And make sure, of course, that it is in relation to the doctor and also in insecure senior centers. So at this time, I'm concluding and open for questions. I can see chat box here. People can type in the question. I can certainly answer them.